When should you see a doctor for hip joint deterioration? Have you been wondering when it's time to see a doctor for hip joint deterioration? It's crucial to pay attention to your body. If you experience persistent or worsening hip pain that disrupts your daily activities, it's time to consult a healthcare professional. This is especially important if your pain is accompanied by stiffness, reduced range of motion, or difficulty walking. Early medical evaluation is key when symptoms suggest osteoarthritis or other joint issues. This helps prevent further damage and optimizes management. Hip joint deterioration is often linked to osteoarthritis, which involves the gradual breakdown of cartilage. This breakdown leads to pain, inflammation, and impaired function. Here are some key signs that indicate you should see a doctor. First, if you have persistent hip pain lasting more than a few weeks, especially if it worsens with activity or at night, you should seek medical advice. Stiffness and reduced mobility in the hip joint can also be a sign. If you find it difficult to walk, climb stairs, or perform routine tasks, that is another reason to consult a doctor. Look out for swelling or tenderness around the hip. A sensation of grinding, catching, or locking in the joint can indicate a problem. If you notice a decreased ability to bear weight on the affected leg, or if the pain radiates to the groin, thigh, or buttocks, these are significant symptoms. Additionally, if your symptoms do not improve with rest, over-the-counter pain relievers, or lifestyle changes like low-impact exercise and weight management, it's time to see a healthcare provider. Early diagnosis and treatment can slow progression, manage symptoms, and improve your quality of life. Treatment options may include physical therapy to strengthen the muscles around the joint, appropriate use of pain-relieving medications, and, in some cases, corticosteroid injections under medical supervision. Do not delay care if your symptoms worsen or if you develop new signs like joint deformity or an inability to move the hip. If your hip pain is severe, sudden, or linked to trauma, or if you have risk factors for conditions like a vascular necrosis, immediate medical attention is necessary. Consulting a doctor promptly allows for tailored management strategies, including exercise programs and dietary advice to reduce inflammation. In conclusion, do not ignore ongoing or worsening hip joint symptoms. Early consultation with a healthcare provider is essential to diagnose the cause of hip deterioration, initiate appropriate treatment, and maintain joint function.